Um, we are resuming meeting number 27 of the House of Commons Standing Committee on Procedure and House Affairs. Today is April 20th, but we are on the April 13th meeting right now currently. And this meeting, like always, is taking place in hybrid format pursuant to the House Order of January 25th, and therefore members can attend in person, but I believe everyone is currently attending virtually. So you guys all really know the drill by now, and I think even the subs we have at this point are subs we have had before. So please, raise your hand in the toolbar box below in order to speak to any issue. And I will let you know, since we are resuming from the last meeting, we do have a running speakers list. We are still on the amendment of Ms. Vecchio's motion. So that was Mr. Turnbull's amendment on the prorogation motion, or the witness motion on the prorogation study put forth by Ms. Vecchio. The speakers list that we have is Mr. Long. He was had the floor at the time we interrupted or suspended our last meeting. Then we've got Ms. Pettyput Taylor. Then we have Dr. Duncan, and then we have a few others that aren't here today, but I'm told they may be here later. So I don't know whether they'll just get dropped off the list, or perhaps they'll be able to take their spot. So we will begin with giving the floor back to you, Mr. Long.
Well, thank you, Madam Chair, and good afternoon for me here. I'm coming to you from the beautiful riding of St. John Rossay. So I am an hour ahead of you all, and I certainly want to thank you very much for allowing me to sub in again. I find obviously PROC is a committee that does great work for Parliament, has done great work for Parliament, but obviously we're at a point in time right now where we are certainly held up, stuck. I think not to repeat history, but certainly the amendment that my great friend MP Turnbull has submitted, I think is reasonable. I think it's fair. I think it certainly, as we say, everything like that is there's a compromise, and we need to go back and forth. And I think MP Turnbull's amendment is valid. He certainly takes out the part with respect to the Prime Minister, but replaces, says that we'll invite Deputy Prime Minister, Minister of Finance, and Minister of Diversity and Inclusion. Again, we've been through this before. I don't think continuing to draw a hard line in wanting the Prime Minister to come before PROC to testify, I don't think that accomplishes anything. I think that, the Conservative Party in particular hasn't found what they want. I think the answers have been found, but they haven't found what they want. So they need to continue to try to call more witnesses and interview more people. And, I don't think we're getting anywhere. And I think, again, that the compromise was fair. I think that we had every right to prorogue Parliament. I think that we did need a reset. Canadians are not focused on this. Canadians want us focused on governing. Canadians want us focused on doing the work that parliamentarians should be doing. And certainly yesterday, I mean, how can we not mention the historic day, I think, that we all saw yesterday with Finance Minister Freeland, delivering a historic transformational budget that will change for the better the course of our country and change for the better the lives of millions of Canadians. Again, I won't go too deep into the budget because that's not what we're really here to talk about. But when you see, the delivering of $10 a day daycare, the replenishment of, the trade corridor funding, housing funding, a 10% increase for seniors, so well deserved. A 10% increase for seniors over 74 years of age. I can tell you this: the emails I've got, the phone calls I've got, are so supportive and appreciative of what we're doing. And, we want to finish the fight against COVID. We want to be focused on our recovery. And we want to put people and Canadians first. And that's what that budget has done. And that's what we are focused on delivering.
Appel au règlement, Madame la Présidente.
Point of order, Madam Chair. Point of order. This is very interesting. I'm not tired of listening to Mr. Long, but I'd like us to get back to the amendment to the motion, please, to be sure that our file goes ahead in the right direction. So I'm just reminding him in a friendly manner that we should get back to Mr. Turnbull's amendment. That's all.
I see the point Mr. Long is trying to make as to us coming to a resolution and try to move on, but maybe not go into too much depth in your examples there. Just a reminder.
Sure, that's more than fair. I guess my point, Madam Chair, was just to say that, and again, I appeal to everybody on this committee that that's what Canadians are focused on. That's what Canadians want us as parliamentarians to be debating and exchanging viewpoints and ideas. That's what we were elected to do. And I just think that, look, I'll wrap this up because I know my colleagues are ready to go here, but I just think that MP Turnbull's amendment to MP Vecchio's motion is fair. I think it meets halfway. I think it will allow us to move forward as a committee to do the great work that we should be doing. So I will turn it over to my great friend and Moncton Riverview Dieppe MP, Jeanette Petitpas-Taylor. Thank you very much.
Thank you, Mr. Long. Ms. Petitpas-Taylor.
Merci beaucoup, Madame la Présidente.
Thank you very much, Madam Chair. Once again, I wish to thank my colleague and friend, Mr. Long of St. John, who has become a regular member of PROC. So thank you for your help in these past few weeks. We miss Ryan very much, but we hope he'll rejoin us soon. And we all recognize that our friend, Mr. Garrickson, is in the house, so he can't be with us right now. All this to come back to the motion that we're debating right now, again today, the question of the amendment that Mr. Turnbull had tabled a short while ago. To be clear, from the beginning, I said that we are prepared to proceed with the drafting of the report on this study. Until now, to recap, we heard many witnesses who appeared for this study. I made a brief list, but we heard from Kathy Brock, Professor Hugo Cyr, we heard Dwayne Bratt, Pablo Rodriguez, the minister, who spent really a lot of time with us on this topic to discuss prorogation. We also heard Alan Sutherland, another expert, Barbara Messamore, Professor Philippe Lagacé, Laurie Turnbull came before us too, Ian Brody, and lastly, members of the Privy Council. So we see here that we heard a lot of witnesses, and really and truly, I think we're now ready to draft the report. Now, having said that, I do want to be flexible. I do want to reflect on this and share what I've come up with about the amendment that was prepared by our friend and colleague, Mr. Turnbull. And I think for those of us who know Mr. Turnbull, he's attempting to mediate, if you will. He wants us to get to a point that we can all agree on. And I think that there are good points here. And I wanted to share my thoughts about that. I also think that we should invite the Deputy Prime Minister and now our Minister of Finance, as well as the Minister of Diversity and Inclusion, because I think if we look at the situation, there are probably many questions that we could put to them to get their views and ask what their thought was at the time of prorogation and why it happened. We are a government that believes that the ministers are responsible, they're effective and transparent, and they increase the bar by answering questions from members in committee. Although I'd like to discuss Mr. Turnbull's motion directly, once again, I'd like to say that nothing's more important than attacking the worldwide crisis of COVID-19. I mentioned this when we debated Ms. Vecchio's motion, but in my riding at this point, I never hear about prorogation, but people are very worried about the increase in cases of COVID-19 and this worldwide health crisis that affects us all. As we are discussing politics, there are millions of people who've developed COVID worldwide, and we're not exempt from that in Canada.
Many lives have been lost.
Partout autour du monde entier. Puis on voit exactement.
This has been a crisis of suffering all around the world. It's one of the worst crises that we have ever seen. And I think that we have been very fortunate in the Maritimes. Today, we have 158 cases in Moncton that are active. Now, it's still worrisome. We're a small province. However, when you look at other areas, other regions, I think that the situation is being managed well. However, that could always change. Once again, so many lives have been lost during this crisis, and because of this crisis, I think that these numbers aren't numbers alone. These people who've died are our grandparents, family members, friends, brothers, sisters, and so many other people. And I am thinking of all those people who have lost their loved ones. And I'm thinking of all our health workers. And I thank all our health workers and essential workers for their sacrifices, all those who have helped this society. Those who have looked out for their neighbors and their communities. And above and beyond saying thanks, I think that we all have to do our part to slow down the spread of this virus. COVID-19 is a global, unprecedented health crisis. And now we're seeing the consequences of the third wave, which have really shaken the very foundations of economies throughout the world. And that should be the focus of our attention right now. In terms of the amendment before us, and in terms of what I think about it, I'd like to begin by explaining why I think we should be renewing the invitation to the Deputy Prime Minister. First of all, she is a remarkable woman, and I think that she has had key roles to play. She has had discussions with the Prime Minister and within the Cabinet, and so I think she would have an interesting perspective to share with us and to be able to talk to us a little further about the reasons for prorogation. I think we have heard plenty of information, but if our committee wants more information, I am convinced that the Minister of Finance and Deputy Prime Minister would be a good person to invite. Our government understood that our lives were completely disrupted by the pandemic. When you think to this time last year, who would have thought that we would be relying to this extent on Zoom? Who would have thought we wouldn't have been able to sit together as a committee? Now we're at home and we're isolating again. Office buildings are empty, roads are quiet, and once again, in many areas, schools have been shut down. Here, we don't necessarily have as much to complain about or much to complain about, period, because lives are beginning to return to normal. However, in places like British Columbia, the situation is very serious. There is a third wave out there, and we have to continue to follow health guidelines and to encourage people to get vaccinated, because that is what is going to get us through this crisis. I am so proud of Canadians and their communities and how they have all adapted. Our government had to strike a balance between the health crisis and the economy. Now, some people have said that it's been a choice, but it's not a choice. That's a false choice. And the Minister of Finance has said that over and over again. Health and economy go together. Health and the economy go hand in hand, as we have said so many times. We promised to be there for Canadians during the pandemic. And that is a promise that we made, planned to keep, and will keep. Our government had a number of goals. First of all, to protect the health and safety of Canadians, to provide them economic support so that they could isolate at home, so that we could slow down the spread of the virus, and so that jobs could be protected and livelihoods. You know, we asked Canadians to do something very exceptional, to stay at home, because we wanted to curb the spread of the virus. And for the most part, Canadians heard us. However, we had to be there to help them do that, to support them through this hardship. In order to protect the health and safety of Canadians, we closed the borders. We directly funded the provinces and the territories to the tune of $10 million for the recovery. We bought PPE. We bought screening kits. And we pre-ordered vaccinations, received them, and shipped them, and will continue to ship them. The most important thing that we can do now in terms of COVID spread is to get vaccinated, to test people, and to continue to do contact tracing. And I think really that magic mix has been the testing combined with contact tracing in order to ensure that we can find out where the cases are and to isolate them. And that's what we've done here. Now, our province is smaller, obviously, but thanks to these efforts, I think that's really been part of the solution here. That's what has protected us here in the Atlantic provinces. The government bought vaccinations, bought tests, and we've been doing contact tracing. Once again, if we were to invite the Deputy Prime Minister, she could come before the committee and explain once again what they were thinking when they decided to prorogue, what kinds of discussions they had about this. In Canada, we've had the most important vaccination effort in our history. There has to be enough vaccination. There have to be enough vaccinations available for a first dose for all Canadians who are eligible, and we will do that by the end of June. Now, we are on track, as Major General Fortin has explained. We are on track to provide these first doses by the end of June, and by the end of September, there will be 100 million doses of vaccine. So there is light at the end of the tunnel. Once again, though, we can't put all our eggs in one basket. We're all looking forward to these vaccinations, but we have to continue to follow public health guidelines because vaccinations alone won't get us out of this crisis. We have to continue to comply with the guidelines. In the spring, when the Canadian Armed Forces had to participate, they went in and helped take care of our seniors. And Mr. Lauzon, I'll recall, spoke to us so clearly about the work of the Canadian Armed Forces and the kinds of services they provided to Canadians at the time during this crisis. Long-term health care homes really bore the lion's share of the burden. 70% of deaths occurred in those people over 80 years old. That's 2 times the average of other countries. It truly is a tragedy. Unfortunately, it happened again during the second wave. I'm thinking of all these long-term healthcare homes in my own community. Deaths amongst seniors are not just numbers. Seniors are people we know. You know, as a member, every year I go and visit long-term healthcare homes. And these are people who like to speak, they like to chat, they like to know what we're doing, they want to hear about politics, they want to know about their pensions. And oftentimes we get into a little jig with them, some dancing. These aren't just numbers, these are our friends, these are our neighbors. I miss them, they miss us, and I'm so looking forward to being able to see them again one day so that we can spend time together. We owe everything to our seniors. They were the ones who built this country. Now, I know that we're not here to talk about the budget that was announced yesterday, but I will go off on a bit of a tangent to say that I'm so pleased to see that there will be a $3 million investment to assist these long-term healthcare homes because we recognize that these centers need more assistance. The greatest tragedy in this crisis is the loss of lives in these long-term healthcare homes. Many of us, as I said, have had many opportunities to share our concerns. And we must do everything in our power to make sure that seniors are receiving the support they need. Now, even though long-term health care homes fall under the jurisdiction of provinces and territories, the government is doing everything it can to support seniors while working hand-in-hand with the provinces and the territories. Our government is going to cooperate with Parliament in terms of amending the criminal code to penalize those who are responsible for the neglect of seniors or any measures that would put them in danger. Our government is also working with provinces and territories in order to establish new national standards for long-term health care homes so that seniors receive the best care possible. Once again, I'm not going to summarize everything that was said by my friend and colleague, Stéphane Lauzon, the Parliamentary Secretary for Seniors, because he actually did give us a very clear outline of everything that needs to be done for them. But once again, I want to underscore that the development of national standards for long-term healthcare homes is necessary, and we have to take additional steps to help people. I would say not only in long-term healthcare homes, but also to help those people who want to be able to stay at home for as long as possible. Here in New Brunswick, our seniors often tell us this, and I'm sure it's not just in New Brunswick that this is happening. They say that they would like to be able to stay at home for longer. If they had a choice, they would stay home for longer. In New Brunswick, we held a pilot project in order to try and establish programs that would help our seniors stay at home for as long as possible. And perhaps if Minister Freeland comes to speak to us, she could tell us a little about the options related to this. Because if we want to protect our seniors, then keeping them at home for as long as possible is a very attractive option. Very important measures were laid out in the speech from the throne that was addressed to us after prorogation. Like many of my colleagues, during prorogation, we had many consultation sessions in our communities, and people spoke to us about what their priorities are, especially during a global pandemic. The priorities at the time that were laid out in the speech from the throne in 2019 changed. Despite the fact that there were similarities, our priorities had to change. So that prorogation period really helped us self-assess and determine what our priorities should be. I think it would be important to hear where we are at now in terms of safety measures. Seniors are an important part of all our communities, and we need to do everything we can to protect their health and their rights and their well-being. We also have to listen to their wisdom and their knowledge and their talent. We need to recognize that and help them with the challenges they're facing. We also need to help protect jobs, and so the government brought in steps to help businesses and workers. And I think, once again, that if we invited Deputy Prime Minister Freeland, she could speak to us more about that. We also had to limit social contacts, and what that meant was that there was going to be an economic slowdown. There would also be a reduction in the number of people being served in restaurants. And I think what we've seen in several provinces with this third wave is that we're going to have to reduce contacts again in order to be able to get control back. We have to ask people to stay home. And people have been asked to stay at home if their children are sick, if they're sick. It would have been unfair to ask businesses to close their doors and ask workers to stay at home without compensating them for their income loss. Less than a week after our country had to close down, we announced an economic recovery that included emergency measures for businesses and workers. We put billions of dollars into businesses in order to help them and in order to be able to help workers. We also strengthened the support benefits for those people who lost their jobs.
I'm sure that you know and remember the conversations and the phone calls, the daily phone calls we had with the various officials of the departments. And I was very happy as a parliamentarian that all political parties had been working very hard to ensure that we would develop the best possible programs. Of course, at the very beginning, the programs were not 100%. We didn't have all the answers, but together we were able to change these programs to really respond and respond to the needs of Canadians. And once again, in inviting Minister Freeland to come to talk to us, she could share her reflections on that. Monies that were spent would help Canadians to purchase food and pay the rent, and to help businesses also pay for their employees and their bills. Now, I made a quick research yesterday in looking at the case of New Brunswick to see at expenses or investments that were done in my little province of New Brunswick, just to give you an overview. Now, when we look at the emergency account for Canadian businesses, now since April 15th of this year, there were 1,870 loans that have been granted to companies, a value of $626 million. Now, for the emergency relief program for commercial rent until February 24th in New Brunswick was the 1,363 renters representing 10,282 employees for a total funding of $11.59 million, which is quite an impressive amount of money. Now, with regard to the emergency rent relief until February 14th, we had received 3,210 requests that have been approved. The total amount was $7.4 million in grants.
Hate to interrupt, but I was wondering if you could just slow down a little bit for the benefit of the interpreters. They're having some difficulty. You generally speak a little fast, but then right now it seems like it's getting faster and faster.
Sure, I will certainly slow down. Absolument.
Thank you so much.
Ça fait juste comme ça pour reprendre.
So maybe just to go back to the investments that we did in the province of New Brunswick, the financial assistance programs for companies and for citizens of my province. So let's start with the emergency account for Canadian businesses. Now, until April 15th, we had 11,800 loans that have been granted to companies for a total value of $626 million for the province of New Brunswick. For the Canada Emergency Relief for Commercial Rent until February 24th, there were 1,364 renters representing on average 10,200 employees that received a total funding of $11.59 million. Now, when we look at the emergency assistance for rent and the lockdown compensation, we have received 3,210 requests as of February 10th that have been approved, and the total amount was $7.4 million in grants. Once again, when we look at the wage subsidy, the emergency wage subsidy until March 7th of this year, we had received 55,000 requests that have been approved for a total of more than $1 million in subsidy that helped us protect about 11,000 jobs. Now, when we look at the Canadian emergency relief until October 4th, there were more than 165,000 people in New Brunswick that had made an application for this emergency fund. And we can see that this really greatly helped the population. It's about 1/5 of the population that was able to benefit. Once again, when we look at the issue of the Canadian benefit until April 11th, we received $209.8 million, which was given to 27,000 citizens. And finally, the until November 11, $5.5 million were given to about 600,000 people. Now, I'm mentioning these figures, and I did some research yesterday, and I was also thinking that when we look at the federal assistance to provinces, territories, and to the people of our communities, we can see that a lot of reflection went into that, a lot of investments were made. And I think that if we would to invite Minister Freeland, we could ask her specific questions, and she could also share with us what worked well and which adjustments have been made. So I think that she could certainly help us to understand or have a better picture. Now, monies that have been spent have helped Canadians to pay for their basic needs. And our government has set up various programs to make sure that people did receive a support. I know that on a day-to-day basis, when I speak to my constituents in my region, Moncton, and asked them what additional support they would need, we hear that CERB really was a life-saving support that allowed people to pay their rent, to pay for their food, and for transportation. But what is also very important, that gave our citizens the opportunity to stay at home, because that is what we had asked them to do. We wanted to avoid the virus to spread. Now, our government has also set up the Canadian wage subsidy that supported 3 million Canadian workers to stay on their payroll list. Our local companies are at the heart of our communities. It's our friends, our neighbors, and we can support them in ordering made food or in local grocery stores. And I really think that the pandemic has shed light on how important it is to support our local businesses. Now, these economic programs are good reasons for us to invite the Vice Prime Minister, who could also give us and share with us the reflections that led up to the prorogation. Parents were also concerned about education costs. So this is why we've invested in families. For 2020 and 2021, we've increased the Canadian child benefit up to $6,765 per child of less than 6 years, and $708 for children aged between 6 and 17. Later, we invested $625 million in federal emergency support to ensure safety, quality, and affordable access to childcare. Once again, we're not here to speak about yesterday's budget, but I must say I was very happy when I heard the priorities stated. So to ensure that we can continue to do the necessary investments to have a national childcare program that is affordable, and we can thank Quebec. Once again, I look to my colleagues, Mr. Lezon, Terrien. You have exceptional childcare services in Quebec. You have a plan that has been outlined for us, and we can now follow your example. And we have a lot to learn from Quebec. You are a very progressive province, and we should be looking at what has worked well. Our also understood that an additional support was necessary for banks and for food banks. Now, without that support, COVID-19 would have had an additional impact on vulnerable communities. We know that many Canadians count on food banks and on community organizations at a local basis to feed their family and to find support in difficult times. Now, in my community, in Moncton, Riverview, Dieppe, I would like to take a moment to really thank organizations like Food Depot Alimentaire, Centerpeak and McKee, and United Ways New Brunswick's for their work and support to deliver healthy food to our citizens. As I am speaking, I'm very happy to mention our Moncton businesses. And when I think about Food Depot Alimentaire, they're offering healthy, nutritious food to hundreds of families in our community. And thanks to volunteers, I must also say it's the National Week of Volunteers this week. So all these community organizations are doing an incredible work, and we have to thank them for them. When we look at the issue of United Ways, I think I had mentioned when we were discussing Ms. Vecchio's motion that here in Moncton, we are very lucky to have a program for seniors. United Way are preparing food for our seniors. Every week, they deliver more than 600 meals, and the volunteers prepare them. They deliver the meals. And once again, we're very lucky because thanks to the investment, we are helping them to continue to do their wonderful and important work. Our government also understood that young Canadians were facing unprecedented challenges. So we doubled the Canadian student benefit and created the Canadian emergency benefit for students. We wanted to make sure that students had the help that they needed to be able to continue their studies. And also think that thanks to the investments that we made, our students were able to receive the help that they needed. Now, vaccine fairness is another reason and for the Vice Prime Minister to come to talk to us. Vaccines are necessary to help going from the closure of our society to putting an end to the virus. Once again, we know that the third wave is a very strong wave. More transmission means also more variants. More there are variants of concern, more it is likely that they will maybe escape the vaccine. As long as the virus will continue to circulate, people will continue to die. And traveling and businesses will have difficulties and the recovery will be postponed. The world vaccination campaign is the greatest moral test of our times. Many countries, low revenue countries, have not yet received a single dose. I know that Canada decided to increase funding for deploying vaccines in low and mid-income countries and will give additional funds to the COVAX program as other richer countries will intensify their efforts. So once again, I think that inviting Minister Freeland to come to talk to us, she could also respond to questions and she will be able to share, her reflection around prorogation. New commitment or the total contribution of Canada, $940 million for the COVAX program. It would be good to hear the reflections of the Vice Prime Ministers about the way the world has to unite to produce and distribute additional sufficient vaccines for all, which means at least doubling the manufacturing capacity worldwide. And we also need to see that it is very important and that this is something that is important. Now, the unfair distribution of vaccine is a moral failure. And from an epidemiological point of view and financial point of view, it's destructive. It's only together that we'll be able to put an end to the pandemic and to recover. It's only together that we will be able to launch our economy. Now, the eventual recovery will be faster and more complete in direct proportion with the measures or with our attempts to overcome the virus. Now, hearing about the state of our economy would be another reason to invite our minister. We entered this crisis with an interesting budget position. When COVID-19 struck, Canada had a debt ratio that was the lowest amongst G7 countries. What investments will help our economy to become stronger than before and have a greener economy, an economy of innovation, an economy that is going to be fairer, that supports good jobs for all Canadians? We want to get out of the pandemic.
We want to come out with a wealthier and greener economy, but right now we are continuing to focus on fighting coronavirus, and the health and safety of Canadians continues to be our top priority. We're doing everything in our power to ensure the health and safety and solvency of Canadians. Another reason why we could hear the Deputy Prime Minister is to hear about all the lessons learned. I think my colleague, the Honourable Christy Duncan, put forth a motion we could also study, but I think Minister Freeland could share her thoughts about the lessons learned. And allow me to be very clear here. There'll be a lot of time to examine our response in the future, but to date, what are her thoughts about preparation? I think we must all be ready. The government, the private sector, government organizations and non-government organizations, as well as international organizations. Because we aren't prepared, we're confronted not only with serious impact, but economic consequences that are devastating, as well as major inequality and vulnerability. A virus can cancel out any economic progress. I'd also like to suggest that we could hear the Deputy Prime Minister talk about the other world crisis that we're confronted with, and that's the whole idea of climate change. We'll set that aside for now, because today it's the matter of the health crisis and COVID-19. But still, I think that we could ask her for her thoughts about climate change too. The last reason I'd like to share about why we should invite the Deputy Prime Minister is because we might have important questions that affect all our communities. I'm sure that Mr. Lauzon, Mr. Terrien, Ms. Vecchio, Mr. Morrissey, Ms. Duncan, Mr. Blakey, Mr. Long, Mr. Eater, all have questions that concern people in our communities. And the Deputy Prime Minister could be asked about the economic recovery following COVID-19. My priority is to serve people in my area of Moncton, Riverview, Dieppe, because that's an exceptional community. It's a community that believes in helping one another. I want us to face this difficult period together. I will always be there to support these people in these difficult times. The pandemic has affected the seniors, the disabled, women, girls, Indigenous people, and racialized individuals. We have to understand that systemic racism is real, and unconscious prejudice is real. It happens here in Canada, yes. I know. It's been almost a year now that we've been hearing about the whole George Floyd debacle. When we talk about unconscious bias, we've all evolved and thought about what's going on in our communities. On the world level, I think because of the pandemic, we can see that it has started scapegoating certain people and led to xenophobia. And we have to deal with that. We have to be solidary with everyone affected by racism and whose human rights are affected. Canadian MPs have condemned the increase in racism and racist attacks against Asians in North America, as well as our horror about the shootings in Georgia. Because the virus started in China, people are calling this region outrageous things, and we've seen discrimination and violence against Asians. Statistics Canada said in July 2020 that Canadians of Asian origin were more likely to say that they didn't see an increase in racial harassment during this pandemic. The most significant increase was seen among those of Chinese, Korean, and Southeast Asian origin. A report by a national council was established in September 2020 and showed that in Canada, the reporting of racist incidents against Asians were higher than in the U.S. since the beginning of this pandemic. It's essential that we promote inclusion and people's sense of belonging to guarantee the safety of all Canadians. Given that the Minister of Diversity, Inclusion and Youth has a mission to build a country where everyone has an equal chance to succeed and must defend economic diversity in Canada and promote greater inclusion, it would be a good opportunity to put questions to her about that. We have to work together to build a fairer future for all of us, and we must always fight racism and prejudice and promote respect, compassion, and equality. Madam Chair, I see that I've talked longer than I had expected, but once again, I have many other thoughts to share during this debate. However, I'd like to give the floor to my friend Stéphane or Christy. I don't know who's the next one on the list, but once again, Madam Chair, I thank you for this opportunity to share a few thoughts that are important about this subject. Thank you.
Thank you, Ms. Pettipat-Taylor. Next, we've got Dr. Duncan on the list.
Thank you, Madam Chair, and I will begin by thanking my friend and colleague, the Honorable Jeanette Pettipat-Taylor, for her compassion, caring, her commitment to community, and for her important speech. I think it's important for people to know she's our former health minister, and her expertise is so appreciated. And I'd really like to thank her for her important comments regarding vaccine equity. I will also thank my colleague and friend, Mr. Wayne Long. I not only appreciated his speech, I also have very fond memories of seeing Mr. Long in his community, and his joy of serving was so apparent. I will begin by saying how much I appreciate the amendment brought forward by my friend and colleague, Mr. Turnbull. I have been clear that I think it would be really important to hear from the Deputy Prime Minister and the Minister of Diversity and Inclusion and Youth. I will also make the same point that I have repeatedly made, namely that there is nothing more important than the COVID-19 pandemic, and that is where our sole focus should be. I think there are absolutely more important issues this committee should be studying. In fact, I have a motion calling for the review of Parliament's response to COVID-19, identifying lessons learned, and putting forth recommendations so that future parliaments are better prepared for a pandemic. As I said, there is nothing more important than the COVID-19 pandemic right now. This is where our sole focus should be. Canada is in a third wave of COVID-19. When I was preparing last week, cases had increased by 82% over the previous 14 days, and we are in a race between the variants and the vaccines. Well, this committee does not oversee pandemic response, and we must be focused as a country on the response. We absolutely have a role to play in pandemic preparedness for the future. It is incumbent upon each of us to ensure that the House of Commons is prepared for the next pandemic, because in all likelihood, there will be a next time. COVID-19 is not going to be the last pandemic. And going forward, the House of Commons, Parliament, governments, the private sector, non-governmental organizations, and international organizations must all be better prepared. When we are not prepared, we face not only deadly impacts, but also devastating economic consequences and new inequalities and vulnerabilities. All of us on this committee, all of us in our communities and right across this country have been touched by the pandemic, and we have to learn from the crisis. We can't forget what we've all been through, and we need to prepare for the future, and this includes our work at this very committee. The job of the Procedure and House Affairs Committee is to study and report on, among other things, the practice of the House and its committees, internal administration of the House, and services and facilities for members of Parliament. All of us need to be asking about the House of Commons response to COVID-19. This is not partisan. It's real work that needs to be done. Just as we have done real work on studies on remote voting and how to promote democracy and public health and safety, should there be an election during the pandemic. Undertaking this study, as I've raised before, is important. Past crises have shown that once an outbreak is under control, organizations tend to turn their attention to other pressing concerns. If this committee does not do this study now, when will the study be done? What happens if an election intervenes? It is our committee members who have direct experience, and it is our members who should be asking questions. The point is, we need to review the response to see what action was taken, when action was taken, and what recommendations we can make to be better prepared for next time. And we need to think of the thousands who work here in the parliamentary precinct. They are our colleagues, our friends, who work to maintain the people's house. And we need to be thinking of protecting our democracy during a pandemic or another disaster. But let me bring it back. Canada is in a third wave of COVID-19. We are in a race between the variants and the vaccines. Our health system in Ontario is literally on the verge of collapse, and our healthcare professionals are exhausted. And yet this committee remains focused on politics. Our country reported 9,200 COVID-19 infections 2 Fridays ago, a new single day high since the start of the pandemic. Yesterday, Ontario reported over 4,400 cases of COVID-19, while the number of hospitalizations topped 2,200. It was the 6th straight day of more than 4,000 new infections in the province. 6 straight days of more than 4,000 cases, and yet we have a partisan motion in front of this committee. Worldwide, we have now seen new cases of COVID-19 increase for the 8th week in a row. More than 5.2 million cases were reported last week. That is the most in a single week so far. Deaths rose for the 5th straight week, and more than 3 million deaths. Let me repeat that. More than 3 million deaths have been reported by the World Health Organization. It took 9 months to reach 1 million deaths, 4 months to reach 2 million, and 3 months to reach 3 million. Big numbers can make us feel numb, but each of these deaths is a tragedy for families, communities, and countries. And yet, this committee remains focused on politics. More than 900 million vaccine doses have been administered worldwide. But there is a stark gap between vaccination programs in different countries, with some yet to report a single dose. 83% of shots have gone into arms worldwide have been administered in high and upper middle income countries. Only 0.2% of doses have been administered in low income countries. This unfortunately is not surprising. When HIV emerged 40 years ago, life-saving antiretrovirals were developed, but more than a decade passed before the world's poor got access. While vaccines are a vital and powerful tool, they are not the only tool. Physical distancing works, masks work, hand hygiene works, ventilation works. Surveillance, testing, contact tracing, isolation, supportive quarantine, and compassionate care. They all work to stop infections and save lives. I think it is important for people to understand that young, healthy people have died, and we still don't fully understand the long-term consequences of infection for those who survive. Many people who have suffered even mild illness can report long-term symptoms, including fatigue, weakness, brain fog, dizziness, tremors, insomnia, depression, anxiety, joint pain, chest tightness, and more, which are symptoms of long COVID. Far too many healthcare workers have died in the pandemic. Millions have been infected, and the pandemic has taken a huge toll on their physical and mental health, with devastating effects on their families and communities. Anxiety, depression, insomnia, stress have all increased. One nurse said she's tired of seeing young people die. She keeps hearing more people are getting sick, more beds are needed. She's tired, and she says it's demoralizing. Another nurse says the daily scenes unfolding before her eyes, more acutely COVID-19, more acutely ill COVID-19 patients, and young people fighting for their lives, weigh heavily on her. There's no escaping the hospital even when she's home with her family, who she tries not to burden with her worries. She explains that, and I quote, "Sometimes when I sleep, I just keep thinking. Those things are going through my mind, and I just want to shut it down, just shut off for a minute." She says the thing is, we are not only taking care of the patients, we have to take care of our staff. Everyone's burned out. Heads of hospitals are worried about the number of people who are getting sick, their colleagues, and the cardiac, neurological cancer rates that will follow. And yet this committee has a partisan motion. The pandemic is exposing and exacerbating inequalities. COVID-19 pushed an estimated 120 million people into extreme poverty last year. Gender inequalities have increased, with more women than men leaving the labor force. And rich countries are vaccinating their populations while the world's poor watch and wait. Health inequalities are not just unfair, they make the world less safe and less sustainable. Yet there is a partisan motion in front of this committee. Here in Canada, we have had over 1 million COVID-19 cases. COVID-19 has claimed more than 23,600 Canadians. Madam Chair, I cannot imagine what could be more important than talking about COVID-19 and the race between the variants and the vaccines. The numbers of deaths are not just numbers. They were our grandparents, mothers, fathers, loved ones, neighbors, colleagues, lifelong friends, mentors, and heroes. And they mattered. And they mattered to so many more people. All of us should be asking about the number of outbreaks of COVID-19 in hospitals, the number of healthcare workers who have developed COVID-19, and the number of healthcare workers who've ended up in ICU. All of us should be asking about the number of outbreaks in essential workplaces, in marginalized communities, in congregate settings. And all of us should be pushing for vaccine equity. Throughout the pandemic, racialized communities have been hit hard. In the spring of 2020 in Ontario, the most diverse neighborhoods were hit hard. Hospitalization rates were 4 times higher. ICU admission rates were 4 times higher. Death rates were twice as high. Data from the fall in Toronto show that 79% of reported COVID-19 cases were among those who identified with the racialized group. In Toronto, the neighborhoods with the highest populations of racialized people have the lowest vaccination rates, despite the disproportionate impact of the disease on these communities. A century after the 1918 influenza, poverty, hunger, and well-being, gender, racialization, and economic status still play a role in who gets sick, who gets treated, and who survives COVID-19. Here in Ontario, surgeries are canceled as the province braces for more COVID-19 patients. Cases of more transmissible coronavirus variants are surging in Ontario, and strained hospitals are forced to cancel elective and non-urgent surgeries. Cataract, joint, and cancer surgeries are all canceled. Despite a backlog of postponed surgeries from the past year approaching 250,000. One emergency doctor says if alarm bells are not ringing now, I don't know what it'll take. The system is straining to keep up. Dr. Kevin Smith, CEO of Toronto's University Health Network, wrote, "This is going to be the most extraordinary and demanding time most of us have had in our working lives. It comes to us after a very long year, which has left us feeling battered and drained." And they are battered and they are drained. But this committee is focused on partisan politics. Let me be clear, we are still fighting the pandemic. In Ontario, more COVID-19 patients are in the ICU than at any other point during the pandemic. Canada's Chief Public Health Officer has said the rapidly spreading variants have now likely replaced the original virus as more young people are getting sicker. Hospital admissions are also on the rise as healthcare staff try to keep up with overflowing ICUs. Experts say the number of COVID-19 patients in ICUs continue to test hospital capacities, with patients battling the disease. Coming back to the amendment, the original motion prejudges the need for prorogation. Mr. Turnbull's amendment refocuses the study on prorogation with research, evidence, and facts, and reinviting our Deputy Prime Minister and the Minister of Diversity and Inclusion and Youth. The Prime Minister prorogued in order to take the time needed to understand what Canadians needed during the pandemic. How were they doing? Where were we in the pandemic? How was it affecting their jobs, their livelihoods? Could they put food on the table? How had Wave 1 affected our seniors, and particularly those in long-term care? Where should we go as a country after looking at the science, the evidence, and fact, and hearing directly from Canadians? When dealing with a new disease, it's important to acknowledge that not everything is known. It's important to exercise precaution. With a new disease and new data, information will likely change, and there will likely need to be adjustments and guidelines, policies, and recommendations. If we look what was known last January versus what is known today, there are a lot of differences. Science evolves over time, and decision makers have to be open, flexible, and willing to change course. They have to stay humble in the face of a new virus.
Point of order, Madam Chair.
Nader?
Yeah, there is rules both against relevance and repetition. And I would just note that Ms. Duncan is repeating word for word what she said in previous meetings.
Okay, well, I don't have her speech saved, but I'll let Dr. Duncan respond to that then.
Thank you so much, Madam Chair. And I would like to be clear, I spent last night updating this speech with the new facts, new evidence, new information from the World Health Organization, and new information from the province of Ontario. And I'm here to represent the constituents of Etobicoke North, and I'll debate the amendment that is at hand. I would like to speak about the issues which matter most to our community during this historic time. And this really is historic. It's 100 years since the last major pandemic. We also had influenza pandemics in 1957 and 68. And it is tragically historic. And it continues to inflict unprecedented harm on people, societies, and economies around the world. And I would like to hear from the Deputy Prime Minister. We could ask her about the consultations that were made during prorogation, the investments that the government has made, what more needs to be done. And, you know, yesterday we heard in the budget that there will be investments of $100 billion in Canadians. This budget is about finishing the fight against COVID-19. It's about healing the wounds left by the COVID-19 recession. And it's about creating more jobs and prosperity for Canadians in the
Point of order, Madam Chair.
Yes, Ms. Vecchio?
I really appreciate all that Ms. Duncan is saying, and we have already invited the Deputy Prime Minister. We just yet to hear back. So I just wanted to point that out. And then once again, if we could get back to the actual motion, referring to the budget, that's great, but let's go back to what actually happened. So we're getting the results, but we still don't know why we had to prorogate. So thanks.
Okay, so we're speaking to Mr. Turnbull's amendment at this time to re-invite the Deputy Prime Minister and Minister Chagar and a few others as well. So I think, you know, Dr. Duncan, I'm following closely, and she is speaking to why we should be inviting these people to speak to why prorogation was necessary. So I think I will allow that.
Thank you so much, Madam Chair. Yes, it is about hearing from our Deputy Prime Minister. And I think it's important for Canadians to understand where we are in a pandemic. And Canadians, the people of Etobicoke North and Canadians want to know what will be done for them. And that $100 billion announced yesterday is so important. It's investments in Canadians. Of course, right now, priority is protecting the health and safety of Canadians, their jobs, and their livelihoods. But while the focus is absolutely protecting health, the government must also be investing in the economic recovery. We must ensure that Canada builds back better, that we have inclusive growth, and that we have green growth. And I would like to hear the Deputy Prime Minister's thoughts on the economic recovery. And of course, the budget that she just released, the investments of over $100 billion in Canadians. I know my community, the community I serve, would like to hear about the economy. I did hear from our community that they were pleased to see that the speech from the throne outlined paths to economic recovery. They felt that with the consultations that had been done by prorogation, that they had been heard. The throne speech planned for incentives for employers to hire and retain workers and for training to quickly equip workers with new skills. We have an opportunity to not just support Canadians, but grow their potential. And working with provinces and territories, the government will make the largest investment in Canadian history in training for workers. This will include supporting Canadians as they build new skills in growing sectors, helping workers receive education and accreditation, and strengthening workers' futures by connecting them to employers and good jobs in order to.
Mr. Nader?
I'm again reading word for word what Ms. Duncan is saying from a previous meeting. The last two paragraphs have been word for word what she said in a previous meeting. Again, the rule of repetition states that that can't happen. If she has new information to bring forward, she should, but she should not be repeating word for word what has previously been said in this committee.
Okay, well, I consider all members to be honorable that if Ms. Duncan says that she's stayed up and submitted new facts and evidence to her speech to essentially make the guts of it different. I'll confer with the clerk as well on this. So if you could just give me a second. Okay, so I was conferring with the clerk because I don't want to, I want to take Mr. Nader's point of order seriously and also give Dr. Duncan, the respect she deserves as well and the opportunity to make her point. So I'll just remind members that repetition, especially if it is word for word repetition, is not allowed. If there are new facts and evidence, then to try to focus on that new facts and evidence, and then to refrain from repeating anything verbatim. So, Mr. Nader, thanks for bringing that point of order, and I guess that reminder goes to everyone, and I'll give Dr. Duncan the floor.
Thank you, Madam Chair, and I'd like to thank Mr. Nader as well. I'm so careful, and I'd just like him to know, in fact, last night I checked the blues that were available on the PROC website to look to make sure I wasn't repeating anything, and so I really hope that I have not. So in terms of new figures, I was talking about the importance of jobs. And of course, we saw that in the budget yesterday. I think it's really important that we hear from the Deputy Prime Minister because she talks about a resilience agenda. What does that mean for healthcare? What does it mean for our social systems? And well, we entered the pandemic in a strong fiscal position. It allowed us to take quick and decisive action, supporting people and business. The biggest danger we could have had would have been not doing enough. And I'd like to talk about addressing the gaps in our social systems. And for me, one of the most important things, the worst tragedy was what happened in long-term care. It broke my heart. It broke my heart. Before I ever entered politics, I used to take the children I taught dancing to the seniors' homes in Etobicoke North. And they knew these seniors for many years. And to see what they have lived through, and I've known these seniors in these residences through politics an additional 12 years. I'm afraid when we go back to see who we have lost, they deserve to be safe, respected, and live in dignity. And I want families to know, I know your loss. I know your terrible pain, and I know it firsthand. And I will absolutely raise long-term care again and again and again. And I'd like to recognize Monsieur Lauzon's leadership here. We've all heard about his caring and passion for seniors. He's the parliamentary secretary to the minister. And I'm glad to see in the budget that another $3 billion for long-term care, and that we will be investing $12 billion over 5 years to increase old age security for seniors age 75 and older. If the Deputy Prime Minister came to our committee, we could ask her questions on behalf of our seniors. I know the seniors in our Etobicoke North community, for example, our Humberwood seniors, our Sri Lankan Tamil seniors, our St. Andrew seniors, and this is just to name a few groups, would be really eager to hear from the Deputy Prime Minister. I want to talk a bit about how COVID affected congregate settings, and particularly people with disabilities. I've been a lifelong advocate for disability rights, and I've worked and learned from persons living with disabilities all my life. I've worked with children with autism spectrum disorder. I've worked with adults with developmental delays. And what we saw what we've seen with the pandemic is that the disease spread quickly in these residences. And I think if we look to the survey of disability, more than 6 million Canadians identify as having a disability. That's important for this committee to know. And when we look at the employment, only 59% of Canadians with disabilities are from age 25 to 64 are employed, compared to 80% of Canadians with disabilities. They also earn less, 12% less for those with milder disabilities and 51% for those with more severe disabilities. And they're more likely to live in poverty. And I think it's incumbent upon all of us to build a fairer future where we all have an equal opportunity to succeed. If I look back to the last Parliament, our government undertook the most inclusive and accessible consultation with Canadians with disabilities and brought forth historic legislation. And there's more work to do. There is more work to do. Our government will bring forward a disability inclusion plan, a new Canadian disability benefit modeled after the guaranteed income supplement for seniors. And I think it'd be really important to hear from the Deputy Prime Minister on these initiatives. And next, I'd like to talk a bit about health. And I really would like to recognize my friend and colleague, Madame Petitpas-Taylor, and her tremendous work when she served as the Minister of Health for Canada. I hear regularly from the medical and research community who really recognized how she listened and what she achieved for our country. And I will just highlight her work on the food guide, healthy food choices, and financial support for thalidomide survivors. And of course, I could go on. Over the last many months, it's become clearer that we need a resilient healthcare system. Everyone should have access to a family doctor. And we've seen with COVID-19 that our system has to be more flexible to be able to reach communities. I know with my helping families in my own community, it's been really hard. It's been hard to reach a doctor during the pandemic. Many doctors are not operating. If they were operating, it's hard to get that appointment. If you could get the appointment and you needed a specialist, that took more time. And I'm really concerned about what we're going to see in the future in terms of cancers being diagnosed later, heart and neurological issues. I'd like to talk a bit about hearing from the Deputy Prime Minister when it comes to mental health initiatives. And I'd also like to hear from the Deputy Prime Minister about how we build safer, stronger communities and the importance of having a home. No one should ever have to survive a Canadian winter on the street. Everyone needs a home. It's one of the most important issues to our community, and that's why I fight so hard for affordable housing. It's something everyone deserves, and it's also a key driver of the economy. Another issue that's really important to the people of Etobicoke North is ending gun violence, and it's something I fought for since I arrived in Parliament. I remember back in 2013, a group of grieving Somali mothers came to see me in my constituency office, and they gave me a list of 50 young Somali Canadian men who had died violently, largely in Ontario and Alberta, and many of their deaths remain unsolved. And in 2012, when it was that terrible summer here in Toronto, and we had 33 Toronto shooting deaths, they took the lives of Somali Canadian men. So when I go to a meeting, and if that meeting's of 100 people, and this is during obviously non-COVID times, it's common for 4 mothers to come up to me and say that they are the parent of one of those young men. These are Canadian-born young men. And grieving mothers, community elders, and imams say, these were the children who were supposed to bury us. No one asks about our pain because no one wants to know. Positive Change writes, this is on their brochure, 50 sons, brothers, grandsons, friends lost. Together, let's stop the violence. So it's really important that we do more. And I think it would be important to hear from the Deputy Prime Minister on gun violence. What matters to my community is having a job, having a home, having a safe community, and addressing inequality and healthcare. And what I hear from the youth in our community is that we're in a climate emergency. The global response has been inadequate, and we must urgently change course. And I think it's important for people to understand that we've really faced 3 global emergencies this past year. We've had the pandemic, we've faced the climate crisis, and we also face a crisis of injustice. And the young people in my community, and we see youth leading around the world on climate change, want us to speak up for the earth. And I think it's really important that we have to increase the level of ambition. And I know this week is Earth Day, and there's also an important meeting taking place, a virtual leader summit on climate change. We have to increase the level of ambition. We have to increase the action that will happen at COP 26 this year in Glasgow. Canadians understand that climate change threatens it threatens our health, our way of life, and our planet. And they want to see more action. And really pleased to see that our government is committed to that action. We saw that in the budget yesterday, billions invested. And I'd like to hear from the Deputy Prime Minister about Canada's climate action and what more needs to be done. Madam Speaker, I've been speaking at length. I'm just going to finish by really bringing home that the sole focus of this committee should be the pandemic. It should be the pandemic. It's what I hear in our community. It's what our community members are concerned about. I serve a wonderful community. It is the place where I am born and raised. And it's very difficult because our community works hard. Many are on the front line. And they want to see members of parliament fighting for them. They don't want to see politics. And right now in Ontario, our healthcare system is crumbling. Our ICUs, the hospitalizations have increased, the ICUs have increased, ICU admissions have increased. Patients are being shipped around the province to make room. Very sick patients are being shipped around the province to make room for sicker patients. And you can see we can see the numbers increasing in other provinces. It's not just Ontario. We're seeing the numbers increase in other provinces, and I will just make a plea to our dear colleagues on this committee. I so appreciate working with everyone. I think we have a good committee, and I think we've done good work. We did good work on remote voting. We did good work on putting in place recommendations should there be an election during a pandemic. And I absolutely hope there is not an election during a pandemic, but we do have work to do, real meaningful work. There will be a pandemic in the future, and it is incumbent upon us to study Parliament's response and to make recommendations. And with that, Madam Speaker, I will say thank you to my colleagues and friends, and I will pass the floor.
Thank you, Dr. Duncan. You always speak extremely passionately, but I've seen you firsthand in your community with your constituents, and I'm just amazed. And I think Wayne said this too, how many names you know, how many languages you know in order to communicate with the diversity that you have in your riding. And even when you pop into our ridings, how quickly you connect with people is pretty amazing. And I'm really sorry about the loss in your own family and how COVID has affected you. So it's a real tragedy that's hitting a lot of us really close to home. So next we have Mr. Sims, and then we have Mr. Luzon after that. Welcome, Mr. Sims, to back to PROC. How are you?
Madam Chair, to be quite honest with you, when I say, and I don't mean this as an understatement, the pleasure is all mine. I want to thank Ms. Duncan for interventions going through and her experience, all of which you've just described aptly. And I want to say hello to my colleagues. It's been ages since I've seen you amongst the squares that unfold in front of my screen. Yes, I see you too, Wayne. It's nice to see you as well. I included you in that, by the way, if you had any trepidation. This is something that I want to get into because I took great interest in this. Now, you may not believe me, but it is true. I'm taking a great interest in this, and I'll tell you why. Because when I first got elected in 2004, right? Like, I mean, when I was elected in 2004, I think sideburns were a thing, and I'm not sure if we've progressed further in fashion by then, but nevertheless, that's quite some time ago. I was so naive. I was so green to the whole process of parliamentary procedure. This is an actual true story. I got to Ottawa for the first time. I was standing in a lineup of about 50 people, and the security guard came along. In those days, you had different security guards. You had one for House of Commons. You had a different security guard for the Senate. So I had a Senate security guard come up and say, just walk by. And I said, excuse me, sir. I said, I'm just waiting to get in here. But do you know how long this would take? Because I have a meeting. And so, who's your meeting with? I said, well, my meeting is with the Speaker of the House. And he said, are you from his area? I said, no, I'm from Newfoundland. And he said, oh. And we got to talking. What do you do? I said, well, I just got elected. I'm a member of Parliament. Not sworn in yet, but I just got elected. And he went, he just saw it and he went, come with me, sir. And I went, what did I do? What did I do? And anyway, he said to me, he said, sir, you can go where you want. It's like, well, really? I said, I can go anywhere I want. So I can walk up and see Paul Martin, Prime Minister. And he said, but not there. So it was quite a journey. So when I got in there, he said, are you okay? I said, yeah. I said, can I ask you a question? And he said, go ahead. Where's the House of Commons? Because I was in the lobby of the western side, obviously, of Centre Block. I didn't have a clue where the House of Commons was, for goodness sake. Not only did I also didn't really have much of a history of how it works. So you go in, all I know is from question period, where you get up and you ask a question, and someone gets up and answers the question. Neither of the two are related. What was asked and what was answered would seem to be madly off in different directions. Of course, everything has changed since then, right? I was looking for a reaction. I see that, yeah. But at the time, I was thinking to myself, I know nothing about how this place operates, how this place works. I never undermined its importance. I just thought to myself, how does this all work? So I sat down with as many rules and procedures as I could, talked to as many people as I could, and I'll never forget one individual. He was sitting in front of me in the House of Commons. He was a liberal like myself, and his riding was Peterborough, which I think Minister Monsef's riding. His name was Peter Adams. He had a very thick English accent, and he taught me so much. He's passed away since then, so it's I haven't thought about him in ages until this very moment. And he took on the role of mentor for myself and several others. And I got to see, he got to walk me through a lot of things. And I realized there are a lot of things that happened in the House of Commons that are not written down. It's just based on more tradition than anything else, which we inherited from the UK parliamentary system. I'll get to that in a moment. And I know you're dying in anticipation as a result of that, but I'll get to that in a moment. Shortly thereafter, we went to a session where there was, I'll call it, it was one of the first times that they had instituted a session for new parliamentarians. It was an orientation session. Now, these things are fairly regular now, but in 2004, they weren't that regular. They were just starting out. And I was sitting down with three other members of parliament. Two of us were liberal and two of us were conservative. And we got to know each other. And it was then I realized that, you know, we're members of parliament representing an area of Canada with a lot of the same goals. Because before you come into parliament, what you think of partisanship and what you think of debate is like it's like something that is all altruistic in the sense that you're constantly debating the other. It's not like that. There is a lot that happens that you don't see on the screen. And I mean that from a CPAC perspective, not from Zoom. And I'll never forget the person I sat next to was, well, like I said, we were all members of parliament. There was a guy named Andrew Scheer. You probably know him. And I remember having a long discussion with him, and then we realized how, you know, he being from Saskatchewan, he told me a story, you know, from Ottawa through Saskatchewan, and now representing Saskatchewan, and I being from Newfoundland, and we shared stories about people that we knew in either province, so forth. And there was another MP there, Mike Savage, who is now the mayor of Halifax. And another guy by the name of Jeff Watson, if some of you know him. Jeff was in Essex, in southwestern Ontario. I think he lives in Alberta now. Nevertheless, and I'm talking to Andrew and Jeff, I realized they had such wonderful families, great kids. I spoke to their spouses, their partners, and wonderful people. And you sort of get in that context of why we're there in the beginning, not to be a liberal or a conservative or an NDP, but to further your goals as a Canadian. And sometimes I worry that we're losing sight of that in this virtual world. Now, you might be thinking that's probably not apropos to the conversation at hand, but I only say that to preface my comments by saying that I would like to get into how, you know, Parliament has evolved from a human dimension, as well as the rules and procedures that we're doing, because quite frankly, we are talking about one of those tools that we have in the toolbox known as proroguing of House. Now, people will know what proroguing is, not very many, but they know what it is, as in the superficial meaning of the word proroguing. Far less probably know how to spell it, me included. I've been saying it for years, never knew how it was spelled, to be quite honest with you. I mean, let's be honest, we're all honest. So, but it's a concept by which I think is a tool that we can use that I think is a functional one. I think it's something that, as Canadians, are necessary. I mean, evolved from a country outside of our own, but nevertheless, we've grasped this concept because we think it's one that is good amongst many other traditions, customs, and procedures of the house that we go through. So all that to say, I'm glad to be a part of this because I want to look at this from the functional aspect of what is proroguing of the house, and in a general sense, how our house operates, so that we can handle and pass laws in the most efficient way that we know how, and how the system has evolved. Now, should the system be fixed? Yes, it should be. I look on the screen here and I saw Mr. Nader earlier, who taught me a lot about the Magna Carta, stuff that I didn't know from a session that went on and on and on, which was someone give me another word for filibuster. Okay, a prolonging of discussion that we had. And the prolonging of the discussion that took place primarily from the Conservatives, and also from the NDP and from Mr. Christofferson at the time, I found rather enjoyable. And I actually found it really good. It was quite informative, with characters like Mr. Nader and Mr. Jennis and others who talked about how the Magna Carta had such a deep impact. And we're talking about 1,000 years ago. Did you know? Did you know? Just by way of quick fact, and this is just a quick fact about. Do you know why the House of Commons is green and the Senate is red? The Senate is red because it signifies royalty. Red, the crown and all of its things, the Queen, the King, all through the history of the last 1,000 years. We all know the red means the crown. The green in the House of Commons means grass. No, not that grass. Let's back up for a minute. No, what it means is that when the Magna Carta was signed, it was done outside. There was no place inside for people who are commoners to go inside into an institution that would sanction the fact that they were getting together to debate issues. So they had to do it outside. So naturally, the green represents the green grass outside where they debated. Now, of course, in the modern sense, loosely based on modern sense of debating amongst our peers, you probably look back to Iceland and the Alsing, I forget that word. Anyway, way back when. But nevertheless, the Magna Carta started way back around Runnymede, which was at that time, and that's why you see the green represents the outside of the commoners where they would have to gather and debate. Okay, right, yeah, why did I brought that up? So going back to the basics, the Magna Carta gave us the power of the individual to live in this country, to live in this world, and to make sure that they had the human rights served. And, well, essentially, it was that the role of the crown was not one that was against the people that they served, if I could put it that way. Obviously, it's more complex than that. I'm just simplifying it to the best way I know how. But from all that, over 1,000 years, we've now evolved into the common rules and procedures that we have now. What's interesting is someone made the comment, and I even, during the debate we had, which was the prolonging of the discussion, we'll say, over house rules a few years ago, one of the things we talked about was how unique times can create different measures and rules by which we govern ourselves. Not even considering what was around the corner a year and a half later, in the situation we find ourselves in. If someone had told me in 2018 when it was happening, that I can voice the opinion of my constituents in the House of Commons with a yay, nay, or an abstain in the House of Commons by using this, never would have thought about it. I said, it's insane. I remember there was a member of the European Parliament. She came over from Germany. She had something 25 years, I think, in Brussels. Very smart person, very experienced. And she went up. We invited her because I'm president of the Canada Europe Parliamentary Association. So I invited her to cut her and
Madam
her colleagues.
Speaker, point of order.
Yes.
Although I am truly enjoying Mr. Sims's intervention, I believe that we all have a lot to learn from his 17 years of experience. Perhaps we can get back on the motion.
I think Mr. Sims is going somewhere, but I will remind you that we are on we're on the study of prorogation, and within that study, Ms. Vecchio has called forth some witnesses to be re-invited, and then there is an amendment that we are now debating of a different version of that list of witnesses, which removes the Prime Minister essentially and his Chief of Staff from that list. So anyways, that's the amendment at hand within the scope of a prorogation study. So I'll just gently remind you to bring your comments back to that issue. But I do enjoy as well, Scott, all of the knowledge you do bring each and every time you speak at committee or in the House or anywhere. So hopefully there's still, within that argument, we'll still gain a whole bunch of different knowledge and your perspective out of it.
Thank you, Chair, and I appreciate that. Yeah, sorry, Ms. Vecchio. To be quite honest, you just sounded a lot like my lawyer. Sorry, it was just an aside. But yeah, I'll get to the. Sorry, Ms. Vecchio. I will lace on my running shoes and quickly run to the point in just a few moments. But just before I do that, I just want to sum up by saying that we find ourselves in a situation where so much has changed. And anyway, just to quickly finish that story, and I promise, Ms. Vecchio, I will finish it quickly. What she said was that she witnessed question period and then voting, because we had a vote after question period. And during question period, she said, I really like question period. It's real 21st century stuff. I said, what do you mean? Because you got to understand, in European parliaments, most of them just stand up for 10 minutes, do their spiel, they vent their spleen, and then they sit down again. And then each one does, but there's no debate. So she loved the back and forth. And she thought that's real 21st century stuff. But she said, I have a concern. What's that? She said, you debate like it's the 21st century, but you vote like it's the 19th century. And it's a good point, because all we do is stand up and sit down every vote. There's no electronic vote. Everyone else doing electronic voting except for us, until this came along. So the point is that so much has changed in the House of Commons. How we conduct ourselves. I see you all in a square that's this big in front of me. And I've been seeing that for quite some time. Well, almost a year now, if you look at the Zoom technology. Our schools are this way. You know, broadband internet used to be a wonderful tool to help with schooling in rural Canada. Well, in rural Canada, broadband internet is now the school. That's the school now. And not even rural, but in urban areas, especially for those of you in Ontario, Quebec, going through this latest situation, and my heart goes out to you all. I won't talk about that too much, because I felt that Ms. Duncan did it so emotionally and appropriately that I wouldn't not serve it justice. But it is quite something to see, to behold. So the change that is thrust upon us has to take in consideration everything in the House of Commons. Why prorogue? What does it take? You know, like we used to joke that proroguing the House means it's the old Control-Alt-Delete of the political system. But actually, Control-Alt-Delete is more an election. It's more like F5 refresh, what is happening, what we have been doing, and what we're about to do. Sometimes a government will exhaust itself to the point where, you know, we've done what we said we're going to do. Now, whether you believe that as a matter of debate, but nevertheless, you're going to do all that you want to do to a point where, okay, well, we've done that. Where do we go from here? Well, that calls for a speech from the throne, that calls for a direction, that calls for an indication to the people where you want to go. That's the fundamental, that's the original purpose of this. But that's the government's decision. What if the sands beneath us change, starts to move? What if external factors dictate that life is not normal anymore, as what we knew was normal is no longer normal? Life has changed society has changed dramatically, to the point where when someone asks me as a politician, what's going to come of all this? Who knows? Who knows what changes? What are long-term effects of this? I don't know. How do you judge what the forest will look like if you're still amongst the trees? And I think for us, at some point we have to step back to a certain degree and try to refigure. The speech from the throne following the 2009 election had a distinct direction to it, whether you supported it or not, whether you didn't like the direction or liked the direction. It had a path. But now, the environment in which we walk through now has changed so dramatically. That path has to take a different way. Not entirely different. Doesn't have to go backwards, but it has to change. So you have to think about what it takes to indicate to the country that things have changed, and now we have to think about that. Now, normally I would say to you, think of the budget from yesterday, but I won't get into the budget yesterday. I won't talk about it because I know that's not what we're here to talk about. We're here to talk about the emotion and the amendment and so on and so forth. And I think that I'm glad to be here because prorogation was really the original factor by which that we find ourselves in this prolonged discussion about what it is we want to do and where it is we're going. So those are my thoughts on the changing of the House. I know we all want to change the way we operate in the House of Commons in a way that's befitting of our current circumstances. I'm even willing to say we should go beyond what has affected us through this pandemic and say that we should finally, now that we've made some changes, such as voting through my phone, we can make other changes to the House. Oh, there's Mr. Blakey. He has some good ideas. I think he has one great idea that he'll probably bring up later. But I mean, this is something that we have to discuss. And I'm glad we're doing this because we're talking about prorogation as one of those things. Prorogation is not our invention, but it's certainly something we practice. I mentioned the path earlier that we're down now in the circumstances and the ground beneath our feet that has shifted, and therefore we have to and that's why I think prorogation was justified in this particular instance. I know others would say to you that the circumstances by which the situation with the We Charity was earlier was dictating that, but I have to disagree, not based on the fact that where I sit in the House, but only because I think that this is one of those times. So the question is, would prorogation exist outside of all the factors that you're talking about regarding the issue with We Charity and others? Absolutely would. It'd be completely justified. Because if you look at, and I'll only mention this about the budget, look at it and look at, on the face of it, all the things in that budget that were affected by the pandemic. You may not agree with the actual substance within that budget, but the topics, just look at the index, look at the table of contents. There's not a lot about the table of contents that you can disagree with, no matter who you are. Because these issues have to be handled. The extension of benefits such as the wage subsidy or the CBA, these things. This is something that is providing a great benefit to this country, but they do have an expiry date, and that has to be talked about. All these sorts of measures were not to be talked about before the pandemic struck. We tried with EI from the very beginning. We went into the benefits, the CERB, and going into the CERB, then we had to create this new dimension in financial arrangements with our constituents, and the pandemic dictated all of that. Now, how does that relate to a prorogation? Well, I think that all leads into a refresh of the House. Now, some of you might say, well, then why don't you just call an election? Yeah, well, I'm from Newfoundland and Labrador. Not so much. Things, how would I say this without being insensitive? We just had an election in Newfoundland, the likes of which I don't even know if the Commonwealth has seen before. Not just Canada, but the Commonwealth. In the sense that we got voting in person got shut down the day before we went to the polls. And then you had to mail in your vote. Who knows? We may end up with a challenge based on a charter and the right to vote. It's possible. But a lot went awry, and without pointing fingers at anybody in this particular situation, I'm sure that will unfold, and rightly so. There's a lot to learn from this. The ultimate refresh in the election, it may have worked in other places. I mean, I've read what they've done in British Columbia, and I think they did some really good things, as well as New Brunswick. Some good things there too. And things that we will address down the line. How many times did we debate about voting online? Like, how do you accomplish voting online in a national election without trusting the system completely? That's a hard thing to do. Voting by phone, basically voting remotely is what we're looking at. My goodness, for the House of Commons, we're already doing it. I'll never forget, when I first got into this thing, I was still, pinch me, we can actually vote on my phone now in the House of Commons.
Point of order, Madam Speaker.
Yes, Ms. Petty-Pat-Taylor.
I don't know, is anyone else having any difficulty with the sound, or is it just me?
I wasn't having any difficulty. I don't think. Is anybody else having difficulty? I don't see any. No one, everyone is expressionless. Ms. Petty-Pat-Taylor, I don't know what to make of it.
I'm going to simply take my mic out. So I just want to give a warning, just to do a restart. So I just don't want to miss Mr. Sims's comments. So I'll just be a second.
Madam Speaker. Before Miss Petty-Pat-Taylor does that, I'm just looking at the time, recognizing that we are coming to the end of the meeting, and perhaps we could suspend and return to this delightful discussion next week. Well, Scott, I'm enjoying it. Let's not kid ourselves. It's great. But I'm just wondering if we can just, continue with this discussion at our next meeting on Thursday morning at 11 o'clock. And then, Jeanette, if things work out, you don't have to worry about anything. So I'm just taking that to the chair.
Okay.
Scott, are you okay? Je suis un peu déçue. Ça fait 2 fois.
Well, I'm a little disappointed now. Twice when I've come here, all of a sudden you go in suspense. So I'm a little disappointed. I'm going to start taking it personally.
A few members have happened to a few members before, and they think it's them entering the room virtually. But Mr. Sims, is that okay with you? Although, your comments were riveting. I'm also very shocked by how we've gotten to the point of app-based voting, because I know you more than me have been through some grueling discussions about even changing the way we vote by very minor adjustments before. But it's amazing. But sometimes it takes a pandemic. I wish it didn't. But Mr. Sims, are you okay with
there was so
resuming
much
on Thursday?
There was so much. Sure. I don't have a choice, I gather. So, no, I guess I do, but no, you go ahead. Honestly, Ms. Vecchio, I totally respect Ms. Vecchio's point.
Scott, if you could call me right after this, I'm here to listen to the rest of the story on behalf of all of committee.
Now, don't.
Send my number.
Should I believe that?
A lot of people seem pleased. All right. Well, I guess everyone's in good good mood. And I want to say to Mr. Nader as well, I really hope it doesn't snow because you're not that far from me. And that sounded scary at the beginning when you let me know about that. But let's suspend this meeting. It's suspended until Thursday, 11 a.m. Thank you.
Goodbye.